Paxlovid immediately.
While Nancy Pelosi is ignoring what you're doing for the American people, she's going after your administration for cutting taxpayer-funded health care for illegal aliens. Last night, Nancy Pelosi, she went on NBC last night, dropped a bunch of F-bombs, told Republicans to go F themselves. Has she lost her mind?
We have done an unbelievable job medically. Just this, if you did nothing else, we've done a lot like the insulin. But just this, nobody can ever catch this. This is the biggest price reduction times, maybe 10 times, 15 times than has ever been given before. And this is going to have a huge impact. You know, as I said, Obamacare is not a good thing. It's been bad. And I'd like to make it better. I told them, I spoke to a lot of people, a lot of Democrats recently. I said, why don't we change it? We can make Obamacare much better. We could come up with a new system that would be much better, less expensive for the people and better. This is maybe the biggest breakthrough because, you know, when you're talking about the prescription drugs, that's a big part of it. So we're going to look. This is prescription, but we're going to be looking at that. We could come up and through this whole thing, you know, because I don't know, we'll probably have a shutdown because one of the things they want to do is they want to give incredible Medicare, the Cadillac Medicare, to illegal immigrants. And what that does is it keeps them coming into our country, and like they do in California. And no country can afford that. No country. And we have the border stopped up. We have it closed. We have nobody for 4 months. Zero people came in. That wasn't me. That's by the authorities who happen to be liberally oriented. But just think of that. We have people offering health care to people all over the world that they can't afford to pay. And that's the Democrats. And what that does is it brings people into the country because they want to come in for the health care. But no country can afford it, and they can't afford it. So we cannot allow them to charge tremendous amounts of money for health care for people that aren't even citizens. And in many cases, they come in from prisons, jails, and mental institutions. And we can't let that happen. So we have a big fight over that. We have a fight over open borders. They still want open borders. We're having a fight over men and women's sports, if you believe it. You would have thought they would have learned that it's not a good issue. And we have a fight in transgender, as you know, transgender for everybody. And that, when you talk medically, that's a lot of money, too. That's a lot. Those operations are bad. So those things are also being discussed right now. I mean, can you imagine we're actually talking about open borders, and we now have a great border, and we have a great country. Our country was dead 1 year ago. Now we have the hottest country anywhere in the world. Big difference. Yeah.
What does it say about the state of the Democrat Party when they have a 33% favorability rating on average in recent months, and they're willing to shut down the government over health care?
They are shutting it down. We're not shutting it down. We don't want it to shut down because we have the greatest period of time ever. I told you, we have $17 trillion being invested, so the last person that wants it shut down is us. Now, with that being said, we can do things during the shutdown that are irreversible, that are bad for them and irreversible by them, like cutting vast numbers of people out, cutting things that they like, cutting programs that they like. And you all know Russell Vought. He's become very popular recently because he can trim the budget to a level that you couldn't do any other way. So they're taking a risk by having a shutdown because of the shutdown, we can do things medically and other ways, including benefits. We can cut large numbers of people out. We don't want to do that, but we don't want fraud, waste, and abuse. And, you know, we're cutting that. But they want to have illegal aliens come into our country and get massive health care at the cost to everybody else, and we don't have it. And that's I would say, the number one reason that they want to strike is to get illegal immigrants health care. And, you know, Gavin Newsom wants that, too, in California, and it's destroying California. We can't have that. We're not going to let it happen.
Do you have a plan for dealing with drug companies that are responding to MFN only by raising prices overseas as opposed to lowering prices in the U.S.?
No, they're responding. I understand that question very well, but they're responding by lowering prices. They're helped by lowering prices. You know, there's a price at which they can't sell, and they're helped by lowering prices. In the case of Albert and in the case of Eli Lilly, the fact is our prices are coming down massively. You see, that's just a few of the basics, but they're coming down much more than that with many drugs. And over 1,000%. Think of that, over 1,000% reduction. And we'll show you that next week because we have some of them on the board next week where you have over 1,000% price reduction. No, what's going to happen is you're going to have the market will kick in. This way, the market kicks in. The other way, it was just basically, it was just a form of control. You were stifling the market. Yeah.
Following up on Brian,
This point, is a shutdown inevitable? And how would you describe the negotiations with Democrats yesterday? Are more meetings scheduled?
So nothing is inevitable, but I would say it's probably likely because they want to give health care to illegal immigrants, which will destroy health care for everybody else in our country. And I didn't see them bend even a little bit when I said we can't do that. Okay?
Can I ask a question of Dr. Oz, Administrator Oz? If there is no deal reached on the Obamacare subsidies with the Democrats, is there anything that CMS can do to lower those, or to mitigate the increases of those Obamacare subsidies?
Not really, but we have time. We have time till the end of the year to make the changes I know the president is evaluating, but we should have a clean continuing resolution, get past this budget process as it has happened so many times, and allow the president and leadership some freedom to be able to put some good ideas in front of the legislative bodies.
Mr. President, undocumented immigrants.
We actually do have time for that.
Not eligible for the health care subsidies that Democrats are demanding. So can you clarify, what are you talking about when you say Democrats want to protect their health care?
So when an illegal person comes in, a person who came into our country illegally, therefore breaking the law, and look, we all have big hearts. I have a bigger heart than you do. They're all breaking the law, and they're coming into our country. And we just, as a country, cannot afford to take care of millions of people who have broken the law coming in. We want them to come into our country, but we want them to come in legally. Now we have a strong border, very strong border, thanks to Christie and Tom Homan and the whole group. They've done an amazing job at the border. I mean, we had a border that was reckless. We had a border that was a disaster. They were coming in by the millions. I say 25 million people. You're saying less, but I say 25 million people came in illegally. And no system can take care of the health care of all of those people that came in. Now, a lot of them have gone out. We have over 11,000 murderers. We got many of them out. Many of those people have been taken out.